Hey everybody, welcome. This is In Pursuit of Pizzazz. My name's Renee Errett, and this is where we just talk about people, passions, and perspectives that will put a smile on your face and a zip in your face, otherwise known as pizzazz. So today I am so honored to have Dr. Victor Marcial Vega, and I'm just going to read his bio because it's tons of it. There's so many things. You have graduated from the University of Puerto Rico Medical School in 1984. You completed your internship and residency in radiation at Johns Hopkins and the School of Medicine in Baltimore, Maryland. You are an instructor of radiation oncology at Washington University School from 88 to 90. You are in private practice. You were at Baptist Hospital in Miami, and you're also a clinical assistant professor at the University of Miami School of Medicine from 90 to 94. You testified before the committee, wow, on government reform on March 10th, 1999, about the use of intravenous chelation therapy in the management and cure of cardiovascular disease, cancer, and other illnesses. And you contributed a chapter in the book, The Definitive Guide to Cancer by Goldberg, Coden, and Diamond, and a text book on the use of nutritional alternative and complementary medicines in the management and healing of cancer and other diseases. In 2014, you received the certification from the American Board of Integrative Holistic Medicine, and you dedicate your time to the research and implementation of integrative medicine, which is one of the things we're going to talk about today. And you have been an assistant professor at the University of Central de Caribe and from 2013 to the present, where you teach curriculum for integrative medicine. And to put that into words of people that you help, the patients that you can help, and this is astounding. It's that people with cancer, diabetes, coronary, autism, neurological, arthritis, muscular degeneration, glaucoma. There's so many things that you help with, Dr. Victor. And I just can't even wait to get started to ask you so many questions about this. I do know you through a friend of mine. So I want to be clear with that. I don't know you well at all, just through my friend talking about you all the time. So that's why I really wanted to talk with you here on In Pursuit of Pizzazz. The very first question that I would want to ask you is you are an integrative doctor, right? So if I was just the average person, walking in your office, how would you explain, an integrative doctor as opposed to what people just see as a quote regular MD? How do you explain that to them? And what's the difference to the average person that would walk into your office?
I don't know if you remember, but about 40 years ago or more, medicine that had to do with nutrition, exercise, reduction of stress, and detoxification was called alternative medicine, which was a terrible description
Yes.
because alternative really meant the following: something that regular doctors did not agree with or accept. So that has nothing to do with science. So I
Right.
eliminated that from my practice. Then came the term holistic. Then came the term complementary medicine. Then came orthomolecular medicine, then
Yeah.
functional medicine, and now integrated medicine.
Right.
Now, medicine is only one. There's only medicine. There's nothing else. These are descriptions that have been used over the years to sometimes discredit these modalities. Now, what they all have in common is the following, and the main difference between the regular medicine that we are taught in medical school and what I'm doing today is that right now, I always focus in finding the cause of the patient's problem. What's causing the high blood pressure? What's causing the diabetes? What's
Mhm.
causing Alzheimer's, autism, arthritis, etc., etc. Depression, anxiety,
Right.
insomnia, chronic stress, panic attacks. And by focusing in the cause, we're not only much more effective, but also is more cost effective. Because when you're
Hmm.
managing people from the perspective of, okay, your blood sugar is high. if it's not managed by medications, oral medications, and they give you insulin.
Right.
But they very seldom go to the cause.
Yeah.
And nobody that I know of, for example, will mention to a diabetic patient, the important blood that you should take is not the fasting one. That's going to miss most of the situations that I want to identify in you to be able to help you. You should take your blood half hour before each meal,
Okay.
and it should be 100 or less. And the patients go like, what? That's impossible. And I said, I know. It's going to be tough because you have not been taught this. You have been
Right.
taught, patients have been taught 2 hours after eating,
Right.
if it's 140, 150 or less, you're fine. That's preposterous.
Right.
That's ridiculous, and it's not healthy because you're never going to solve the problem of diabetes in the United States following the regular guidelines that are given by regular doctors. So, integrative medicine, orthomolecular, all of them deal with, in general, treatments that are more in the natural side because most of the things that are causing illness, more than 80% of illnesses are chronic illnesses. Kidney failure, diabetes, high blood pressure,
Mm-hmm.
macular degeneration, circulatory problems, varicose veins, and all these things. When you deal with the cause in a natural way, and I combine everything. I combine
Right.
the regular medicine
Yeah.
that I was taught in medical school. I've been a professor for 3 years, but this was never mentioned to me that
That's great.
reducing stress, in other
Mm-hmm.
words, like you say, possess, being
Right.
wonderful, feeling phenomenal since the
Right.
time you wake up. I mean, feeling
Right.
great, laughing at work. That's
Right.
very, so that exercise,
Mm-hmm.
detoxification of all the crap we're exposed to
Yep.
in air, water, and
For
food,
sure. Yep.
and it has to be the following: excellent, phenomenal nutrition. It's not just
Yes.
nutrition. Oh, you should have adequate nutrition. That doesn't mean
Yep.
anything. You have
Right.
to have the best food that you can find.
Yep.
And then when we start tackling those four things and combining them with something else, because most of my patients are on medication.
Right.
So it's a fine art between slowly and gradually and how to do it, decreasing the medication while you're doing these other things.
Yeah.
So when you're doing all these other things, for example, people with high blood pressure, the blood pressure is going to start dropping
Mm-hmm.
during my program.
Right.
The people with high blood sugar, the sugar is going to start dropping. So we gradually lower the high blood pressure medications, sugar medications, respectively. And then we have somebody that not only will manage the situation, but they're going to be happier, healthier.
Right.
You know what the main side effect of all these things is? That cognitive function
Ah.
skyrockets. I know people of all ages, their
Mm-hmm.
brain is
Yep.
not what it should be.
Yep. No,
The
no, no.
brain
I
is not
agree.
working right
I agree. I agree.
in most people, and it's because of that. There's no medication that's going to take care of it. Well, it's preposterous. I cannot believe that regular medicine doesn't have a permanent solution to Alzheimer's and a permanent solution to autism.
I know. Oh
I
gosh.
have been every day I see people with those conditions getting better and getting back to the fullest potential, being a person that doesn't have any of those things.
Yeah.
Now, when I
Yeah.
tell my colleagues that, they look at me like, that's impossible. I
Yeah.
say, I know it's impossible with the tools we were taught.
Right. Right.
I have medical students that rotate with me. I make a point of educating them. I also educate physicians around the world in Spanish and English. So I teach them all these tools. I have a curriculum that's
Great.
detailed from A to Z, from the paperwork you give the patient with the instructions to the
Wow.
monitoring things that you do with the pH of the mouth
Ah, love that.
and the sugar.
Ah.
Now, when you start eating better in general, more protein and vegetables and less of the other stuff that we
Yeah.
do, half hour after a meal, you have your blood work, your blood sugar 100 or less.
Right.
The same thing with the pH of the saliva. If you eat now and 3 to 4 hours later you do your pH, that's a reflection of how many electrons, how much energy that food gave you.
Mm,
If it wasn't good for you, that's going
right,
to be acidic in your mouth.
right. Yeah,
Acidic is a measure of low electrons in the saliva. So when you have a food that's low in electrons, your body's trying to compensate for it. And the electrons will leave the mouth to go balance the blood because the blood has to stay at an
yeah,
alkaline pH at all times. You cannot survive with an acidic pH. That doesn't exist. When you have a low alkalinity, you may die. That's how
right,
important it is to stay
uh,
alkaline in the blood. This doesn't measure the alkalinity in the blood, obviously, but it's a marker of
right.
how the food that you're eating is affecting you. Then the blood work with sugar, all those things are not taught in medical school.
That's
That is
crazy.
the problem. When you
Uh,
have doctors, my students are all stressed out. They're not sleeping well. They're not eating well. They're not even
Yeah,
integrating the knowledge in the brain because when you're stressed out, you're
right.
not effective. I tell them, if you follow my instructions, I have, by the way, something I recommend to all your viewers. I have 3 meditations or guided relaxations
Hmm.
in Spotify, Apple Music, and Pandora.
Okay.
English, Spanish, and instrumental. I recommend they do this guided relaxation twice a day for 21 days. And we have shown by studying our patients that that has the potential to lower the blood sugar,
Hmm.
lower blood pressure, help with panic attacks, anxiety, chronic
Hmm.
stress, depression, and insomnia.
Right. Because
Uh,
it's bringing up the parasympathetic as opposed to sympathetic, correct?
You can call it anything you
Yeah,
want.
yeah,
There's many ways of describing it,
right, yeah,
but
it's
it goes deeper than that.
yeah.
Because, okay, let's go into the parasympathetic, which is relaxing, and the
Hmm.
sympathetic, which is exciting.
Hmm.
You know, the pituitary gland that's
Hmm.
here behind
Yep.
this area, the pituitary controls thyroid gland, which is the
Hmm.
metabolism of the body, testosterone, estrogen, progesterone, very
Hmm.
important, cortisol, the antidiuretic hormone that the kidney produces to retain water and salt. You see how important these things are?
Yep,
And who
absolutely.
controls the pituitary? The hypothalamus.
Hmm.
And you say, what the heck is that? The
Yeah,
hypothalamus
yep, I know.
is part of what they call the primitive brain, but there's no such thing as primitive and advanced brain.
Right.
It's brain that you're disconnected from
Yes.
and brain that you're connected to. If you
Right.
train yourself enough, you can connect yourself to all parts of your being, even the ones that are unconscious.
Right.
And who controls the hypothalamus? Because we tend to think that the nerves automatically do everything. You are.
You do.
You're in charge, all this cortex, having
Yep.
thoughts, feelings, emotions, tiredness, all these things that are going on. We are controlling all of that.
Right.
We don't
Yep.
realize that it's
Hmm.
us. It's almost like they're separating us from the equation.
Right.
No, we have to integrate ourselves in the equation.
Right. Yeah.
Tremendous power to heal and
Uh-huh.
make a disaster in our lives if we're not trained
Right.
to
Because our
use it
bodies are
properly.
meant to heal for sure. I love that you include everything, you know, that you go at it that way. And because are people often surprised? Like when you go to see them, are they surprised that you want to do that? You know what I mean? Or or that why they're already coming to you, or you know what I mean? Or are they already quote sick and they're like coming to you because they're like, I've tried everything. And so all they know is the medicine. And then they come to you and then you're like, no, wait, let me see. So are people surprised or they already know about you when they're doing that? Do you know what I mean?
They already know about me when they come in.
Okay.
By the way, I don't advertise my
Okay.
clinic, and people come from word of mouth.
Okay.
So when they come from a trusted friend and a trusted
Right.
neighbor, and they tell them, listen, I did this with this guy, and this, they already explain it. So
Okay.
I ask the higher power to only send me the patients that are ready for me. I don't want to
Right.
see patients that are not ready for me
Right.
because it will be a disservice to them.
Right. for
because
sure.
I'll have to get into explaining things that they may not be ready to hear, but the vast majority are ready to roll,
That's great.
uh, and I go at full speed with
Right.
them. I
No,
have
that's
an
great.
hour, and I don't waste time. The very first thing that I do with my patients is I see them walking in
That was going to be my next question. What do you
with
do? That's
with
great.
with family members, with a
Yeah.
spouse.
Yeah.
And because of the experience I've had with many of them, I see immediately how they're relating to each other, what's going
Mm,
on, who's resting, who's not resting, who's a pain in the ass, who's not. It's
right.
very interesting.
Right. Yeah.
So I immediately get into the emotional, psychological, non-physical part, because if I
Hmm.
don't, then they don't retain the information as well.
Smart.
We know, my students know, I tell them, if you're tired when you're studying, go to sleep. And they say, you're crazy. I only have 10 hours to study a day.
Right.
And I say, well, I'll prove to you. And usually women get on with the program faster than men. So I tell them, you're tired, rest and fall asleep for a half hour or an hour.
Right.
And then go back into to studying. What you're going
Hmm.
to find out is that you're going to be retaining more information. You're going to be studying faster. So what you used to do in 10 hours, you may
Right.
make it down into 1 or 2 hours.
Right. Because,
So that
mhm.
doesn't make sense to the logical mind, because
Right.
logically, it doesn't seem to make sense. But
Right.
it goes beyond logic, it's efficiency. If you're relaxed and rested, you're going to retain much more in a lesser amount of time. So that's
Hmm.
how I save time, my
Hmm.
patients save time, my students save time. It's a whole different format. So
Right.
all the students that follow those instructions without exception, within 2 weeks, their grades will go up. They'll be more rested. Their appearance is better. They're going to look
Mm.
younger. When I see
Nice.
them in 2 weeks, I say, you're doing what I
Yeah.
suggested you do. I know.
Yeah. That's great.
Now, the most important thing that we can discuss today, in my opinion, you would think that medical school will be the healthiest place in the planet, all right? But we're right, because a medical doctor, but this used to be the way it was.
Yeah, I believe it.
This is the way it was. A medical doctor is supposed to be the healthiest person in the community. Now they're the sickest in terms of stress. We're not taught how to manage stress, how
Hmm.
to manage nutrition, how to
Yep.
deal optimally with exercise, and how to detoxify the body. We're not taught that, and that was
Mm.
planned. That is a plan. So don't think this was a coincidence.
Right.
This year in Puerto Rico, for the first time since I've been here for 21 years, the course in bioethics that is required of us to be able to renew our medical license every 3 years included the history of medicine as of 100 years ago. 100 years ago, the Carnegie Foundation
Yeah.
was was founded by people that had interest in pharmaceutical agents and petrochemicals. So they went into 600 and something medical school with a Flexner report saying that no, we need to do medications. But medical school, all schools, all of them 100 years ago had nutrition, had exercise, chiropractic, osteopathic manipulation, everything.
Wow.
And then they decreased the medical schools that were authorized to be open from 675 to about 45. So that happened within a year.
Wow.
And since then, the rest is history. Fortunately, now we're coming back into it because, the only way to control this planet is to be able to control the people that have the most credibility in the population, which is medical doctors and healthcare practitioners.
Yeah.
Because you have to understand our job, it could be similar to other jobs in the way that we practice, from a CPA to a lawyer, attorney,
Right.
to a plumber, auto mechanic. But we are specifically here because we have the vocation and the desire to help people that are suffering because
Hmm.
of a health issue, mental, emotional, physical. That's why we're here. We enjoy that. Most
Hmm.
of us had the vocation of doing that. But right now, most of us are miserable because now the system has changed tremendously and it is a disaster.
Yeah.
However, we know now that we are the custodians of the planet.
Hmm.
Nobody else is. You could call it a medical doctor, you call it a shaman in the jungle. Anybody that's in healthcare, whenever there's a tribal reunion to decide what is best for the tribe or the community or our city or our town,
Hmm.
it used to be that the one that had to do with healthcare was the last person they asked, is this road we're making from the river to our homes a good idea? And if the medicine man said no, because that's going to contaminate the and pollute the river from which
Right.
we eat and drink and all of that. So no, do the road over here. I mean, that is
Right.
a major role. Physicians 100 years ago used to say, I don't want you to contaminate my
Right.
air, water, or food because my patients are suffering from that.
Sure.
So now we have a new renaissance. And remember, these are long-term races. It's not a race that you win in 4 years if you're elected to a political office.
Right.
Nah, four
Right.
years is nothing. This is
Right.
a 40-year, 60-year, 100-year.
Right.
The Asians know that the real races are won 100, 200, 400 years from now.
Right.
We have to be steadfast. And now we have a wonderful opportunity going back to the stress. When I see patients that are in stress, the quickest way to manage that is to give them essential oils to
Hmm.
inhale at the time. And I have formulas that are specifically tailored to decrease a panic attack while it's happening in my office, a grief from somebody that died,
Wow.
a relative of the patient, depression, anxiety, stress, insomnia. I give them that to smell within a couple of minutes. Most patients are laughing.
Wow.
So that's
Yeah.
the power of nature to be able to activate the olfactory bulb
Hmm. Yeah.
and do what it needs to do. You know what was the first sense that existed in evolution?
Mm. The smell. Smell? Is that what you're saying?
Yes, but
Yeah.
there were no noses when the bacteria were there.
Well,
So
in
so
even
it's not a
the breathing is like just in general, if people breathe correctly, it's so important. And then when you add the essential oils to it, it's double because people don't even breathe big. They're just like, they just breathe like this. It's like, no, 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 you got to go the whole way down. You got to let everything go
but
into your,
even if they don't go all the way down, because I
you
don't
know.
have the time to explain all of that.
Uh-huh. Yeah.
But the essential oil will go in immediately in the olfactory
Mm-hmm.
nerve and stimulate dopamine and serotonin
Mm-hmm.
immediately. And
Mm-hmm.
it will neutralize and deactivate the amygdala. The amygdala is part of
Mm-hmm.
the midbrain, like the hypothalamus that
Mm-hmm.
controls the pituitary, and the amygdala controls the secretion of epinephrine, adrenaline from the adrenal gland.
Mm-hmm.
So it neutralizes it. That's why they feel this within seconds. And then you can
Mm-hmm.
get, like I was saying, if you got somebody relaxed, they'll learn everything you want to
Yeah.
convey to them much better. But I'm talking about a cell.
Mm-hmm.
I'm talking about the first time in evolution that this started. The cell needed to detect the chemicals that were there to get away from the bad ones and go towards the good food that they needed.
Yeah.
So the cells started developing a chemical detection system that later started developing in the earliest insects and animals and amoebas into the olfactory bulb. That's the largest part of the brain that developed in order to accommodate everything else that it needed to do, because this is the only sense in the body. I give a lecture of just the neurological development of the evolution of smell, which is fascinating. And the other thing is that when you start developing this, you realize that this is one of the most important, is if not the most important sense, because we have sight,
Hmm.
hearing, temperature,
Yeah.
all these good things, hunger, whatever.
Right.
But it's the only sense that bypasses the midbrain. It doesn't get processed by the thalamus in the midbrain because sometimes, in order not to get overwhelmed with the senses, our own brain establishes
Mm.
a level of importance. This is not that
Ah,
important, and we don't have to send
right.
it to the
Gotcha.
cortex so the person becomes immediately consciously aware
Oh,
of it.
yeah.
So, but not the smell. You smell, it goes directly into the
Mm.
cortex, which is the part that makes us be conscious.
Oh,
So you're immediately conscious if you're going to eat something that's going to kill you, or if you're getting into an environment that's going to poison you,
yeah.
or vice versa, something that's good
Yeah.
for you and something that's going to help you for your well-being.
Right.
That's
Right.
why this is right in front of
Yeah.
everything, you know?
Sometimes in my case it's a little too big, but
No, no,
no,
no.
do,
We're gifted. We're gifted with
no,
these
that's right.
noses.
That's what it is. We're gifted.
I
So,
love it.
so do you agree with the statement that we are only as healthy as our cells in general?
Yes and no.
Okay.
Because at a molecular level, the cell could start everything,
Uh-huh.
but sometimes at a greater level, you can start something that's not cellular. So
Okay.
you can be the cause of the problem, and the cell sometimes can be the cause of the problem, depending on which consciousness you decide to activate at the moment.
But ultimately it goes to the cell, whether it's right or wrong, it's still the cell is affected. So that's what I mean, is like if your cells are healthy in general, so like in other words, somebody that's not well with whatever cancer or whatever they have,
Nobody's
their
well,
cells aren't healthy, right?
but
Is that
nobody's well. Do you think
right?
somebody?
Well, you
I
know what I
haven't.
mean. I mean, like, like a
No,
disease that's obvious, that kind
maybe
of a
I
thing.
do. Maybe I do not know what you mean because let me give you the other side of the spectrum.
Okay.
All the population is not well,
Right. I
and that's
agree.
because we keep deteriorating and dying.
Right.
That doesn't seem normal to me as a physician.
Right.
We need
Yeah.
to find some things that are going on here because we're younger and feel better doesn't mean that we're completely well. There are things that are going on.
Correct. I agree. I agree. Yeah. Yeah. Yeah.
And the other thing is that there's something else besides cells and the human body. There are other things that are invisible
Mm-hmm.
that may be more important than the cells themselves.
Okay.
But
Okay.
the cells, if you can be perfectly okay, and then if you feel fear all of a sudden, then everything goes crazy. And you have the same chemicals in your body that you did.
Right.
Everything is the same. But just by that stress, you can destroy a lot of the body. It's amazing.
Yeah.
But,
Stress is for sure one of those things.
and let me go a little further.
Mm-hmm.
Have you heard of pulse electromagnetic fields and microcurrent?
Mm-hmm. I've heard of
E-
it.
Eventually, the last thing that gets into the body that's healthy for you is electrons. The same electrons that are in an electrical socket, but that's too high for our electricity.
Mm-hmm.
We have very low electricity, 70 millivolts, 70 thousandths of a volt. In the wall is 123 volts, which is 123,000 millivolts. So that's why we burn if we get
Yeah. I mean,
close
I
to
mean, for
that.
sure, we burn.
But the electricity we have, oxygen, healthy oxygen is full of electrons. Healthy food is full of electrons. Healthy water is full of electrons. Relaxation promotes electrons. And how do we get electrons from the environment? We also get it from planet Earth. We have shown that the body is electromagnetic.
Mm-hmm.
So it's like a magnet, and it can be detected by devices outside the body. And vice versa, the body can detect electromagnetism outside.
Mm.
If you become proficient at this, you can be able to consciously absorb that electromagnetism from the environment and charge your battery without food. And
Mm.
that has been shown to be, but of course, most of us are not that well trained. So we need to eat, we need to drink,
Right.
we need to
Yeah.
breathe. But we already know about the famous thing of grounding.
Mm-hmm.
Grounding is a very visually obvious way that we can connect with the planet and
Mhm.
charge some of our body with that electricity.
Right. Yeah. That's a really um that's a really interesting thing is the grounding. Now, whenever I think I know the difference. I just want to hear how you would explain it. You know, we know the difference between integrative, and quote regular medicine, but then there's people throw the term around functional and also holistic. So how would you explain that? So somebody's watching, my listeners are watching, and they're like, "Well, I went to a holistic doctor, so isn't that the same thing?" Like, what is that's what I mean? Like, I think I know what well my thoughts are. It doesn't mean it's right. So I want to hear from you that if that because there are so many terms that I find that in my in my industry it's like there's so many terms and you're just like yeah that's not what it is so I want to hear from you where holistic fits and where functional hit fits at in relationship to integrative.
That's a very good question. Let me see how I get started. There's only one type of medicine.
Okay.
It's just medicine.
Okay.
All these terms are confusing.
Yes.
They don't help. And uh, Madam Judge, I'm guilty as charged. I'm guilty
Right.
because I've been using those terms before, thinking that they would
Oh
indicate
yeah.
they're horrible terms.
Yeah.
But most of the people that use integrative, alternative, holistic, orthomolecular, functional, nutritional medicine, they have something in common, which is looking for the cause of the problem.
Okay.
And in general, leaning towards using natural things,
Okay.
air, water, nutrition, detoxification, relaxation, and exercise. So that's very important. Just to think that, you're clear about these tools,
Right. Okay.
but medicine is one. It's
Okay.
just
So
one.
you don't feel like any of them are labeling themselves incorrectly. Everybody's kind of on the same team, so to speak.
We're all in the same team.
Okay. Yeah, it's just everybody's using different words. It's kind
Now,
of
the difference that I have with a regular conventional doctor
right.
that they don't have
Right.
right now
Right.
at this point in time is that I've been in both sides of the fence.
Okay.
So I have an unusual advantage. I've been there.
Right. That's
And then I
cool.
had to decide about this, but it saved my life.
Right.
That's why I had at one point, I was having panic attacks all the
I was
time
just
because
gonna say, how did it? That's cool.
I
Good.
didn't even know how to manage my emotions. I
Wow.
didn't know I was having a panic attack, and I was in a constant panic attack. Some
Wow.
people will not believe this, but this is the truth. While I was awake, I was in a constant panic attack for
Wow.
days, weeks, years,
Wow.
months.
Wow.
It will only stop when I slept, but the minute I woke up and opened my eyes, I was in panic attack again. I thought that was normal. I
Wow.
thought that was the normal rhythm of life. I had to be treating patients,
Yeah.
going at it, but I
Right.
was feeling horrible.
And to be
And
clear,
eventually,
this is when you were just quote you're being an MD, but you hadn't added any of the other things. So this is what you're saying. This is what
yeah,
broke you
I
kind of.
was totally unaware of all these
You're
things.
okay. So
And that was in the late 80s.
wow.
And then
Wow.
in 1991, it all exploded. I could
Wow.
not eat. I could not do anything. I could not think straight. I had a major arthritis. I
Wow.
went to several psychiatrists that, in my understanding, they were crazier than me. So I eliminated all of them. And then I went to see a spiritual advisor,
Uh-huh.
emotional advisor, more than
Mm-hmm.
anything. And she said to me, "This is simple. You don't know the difference between fear and peace." And I said to her, "What the hell are you talking about?"
Yeah.
I didn't even know what that meant. And I say, "You're not aware of it. I'm going to help you now to become aware of it, to become aware of whether you're feeling fear or you're feeling peace. Because if you can develop your ability to tell the difference, then you're home free, because then you can choose which one you want."
Okay.
And in 2 hours, I was feeling like I had not felt all my life.
Wow. Wow.
And then I got pissed off,
Because you had been
R-
doing that so long.
really angry.
Yeah, I would
What do you
too.
say?
I would too. If you got mad because you had been doing it wrong for so long. Is that what you
No,
mean?
but do you know who I got mad? Who
Yourself
I
or
was
her?
mad to? No, not myself.
No.
No, 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 no,
You got
no,
mad at her because she
no,
told
no,
you that?
no. She saved my life
Oh, okay. Who'd you get mad at?
at the medical system.
Oh, okay. That makes sense. Okay, I got you now. Okay. You got
I
because no,
got
you
pissed.
were
I got so mad, and I said, "I'm going to make this my life mission.
good
This
for
is
you.
this is insane. Something this simple saved my life. I would have
Wow.
committed suicide. I was ready
Wow.
to commit suicide. The pain was too
Wow.
much." And I said, "I can't believe that. This was 30 something years later, 33, 34
Wow.
years later." And then I said, "I can't believe that this is not being taught."
Wow. That's an
Now,
amazing part of the story. Jeez.
Now that's why I have these guided relaxations in
Hmm.
all the musical platforms so people can get them for free
Right. Yeah.
because that's a must.
Yeah.
And then if they are ready to take the next step, they can get essential oils because
Hmm.
I've been working with essential oils for 30 years.
Yeah.
That's a game changer. Do
Right.
you know that? Let me just give you my latest finding in the last year that I've been working with tremendously. If you inhale essential oil of rose, just inhale it. We're not talking about taking it by mouth, suppository. That's a different format that I'm working on. But if you smell it and you have an MRI, which is a magnetic resonance imaging of the brain, have you heard of those tests? MRI, CT
Hmm.
scans, things like that.
Hmm.
If you do an MRI of the brain, up to 4 weeks later, as early as 4 weeks later, it shows regeneration of the gray matter of the brain.
Wow. Wow.
Now, how the heck does that happen?
Right.
Two ways. When you inhale, it's like a workout. Do you guys know that if you just contract your muscle and don't relax it, it's not as efficient. You have to
Right.
contract, relax. Later, if you become better at it, you can do a just tension and it will work. So the exercise of the olfactory nerve develops everything that's behind the olfactory nerve. All the nervous system will be regenerated by that
Wow.
inhalation.
Wow.
And so I'm working with that now, where I see that by MRI, you see the structures getting bigger. Structures that were
Wow.
getting atrophied over
Right.
the years. And I have patients with Alzheimer's that do not have Alzheimer's anymore. I have patients with autism that do not have autism
Wow.
anymore. Macular degeneration and other things that make it better. Do you know that the American Cancer Society finally admitted last year that exercise cures cancer?
Wow. Man. Gosh, there's so that's finally, right?
Yeah, but
Gosh.
don't get your hopes up
Yeah, I
because
know.
they 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 have it hidden in the website. It's
Oh,
not in the
it's right,
first.
like down in the like the
It's
fine print.
well, but at least I give him the credit. It's there, but it's
Oh,
not in the first page.
wow,
And that
gosh.
should be in the front page
Oh,
of every newspaper. They found out recently that vitamin D, given injected and by mouth and kept at high levels, would increase the cure of colon cancer,
jeez.
breast cancer, prostate cancer. It's amazing the
That's
findings that I'm
yeah.
seeing now that I didn't see 30 years ago.
Well, that's why they tell us not to go in the sun because they don't want us to get the vitamin. Don't go in the sun. Use sunglasses. Use sunscreen. It's filled with a bunch of stuff. That's not good for.
Well,
You know.
it's more complicated than that because
Well, I'm
most
sure it is,
doctors
but
most doctors have been taught part of the story. And when you have a half truth or less than half, that's garbage.
mhm,
That is garbage. We have to have all the information, of course, that we have available because
right,
we don't have all the information available in the planet. We
right,
keep growing.
right,
But what we have available will take us to the next positive level. If we don't have and include everything that is important, that's why I give free questions to anybody that would ask for them in the internet. for your
Right.
doctor. First
Right.
question to your doctor, and it's not to know what he knows or she knows, it's to prepare them psychologically. First question, doctor, do you have an open mind? Of
Yeah.
course, you're going to say yes.
Right.
Second question, do you think that nutrition can
Yeah.
affect my cure rates from
Yeah.
cancer? They're all going to say yes, but they
Right.
don't know what to do about it.
Right.
And
Right.
then when you start asking all the questions
Right.
I give them, the doctors have a face that my patients tell me about it. They say, "Yeah, this person is screwing me right now, my
Right.
God." And
Yep. Yep.
there's
Yep.
nothing I can do about it. But it's good. It's a good screwing. It's done with
Right.
love and
Right.
understanding.
Right.
Because when you answer those questions, it's over.
Yeah.
You already have made a commitment to acknowledge the importance of certain things. So
Right.
these questions are a must
Yeah.
for patients because most of them don't know how to communicate with their doctors. It's a
It's
pain in the
true.
ass. You
It's
don't know what
true.
to do.
It's true.
So when you have those questions, it's non-confrontational. You're
No,
not fighting with
that's
them.
right.
You're not arguing with them. You're
Right.
just asking them.
Right.
And I ask
Absolutely.
him, take a notebook to write it down or record it, whichever
Mm-hmm.
you want.
Right.
But once you have it on the record that they answer the questions, is exercise important in my cure of other diseases? Of course, they're going to say yes. The least they're going to say, of course, it's important for your health.
Right.
Is stress or the lack of it important in the
Right.
development or stress of health? Of
Yeah.
course, they're going to say
Okay.
yes. So I designed these questions to not only help the patient open lines of communication with their
Right.
physicians, but to help the physician open those lines of
Right.
questioning that if you tell a physician, do you believe in alternative medicine? They're going to
Yep.
send you to hell.
Right.
So I've seen that over the years. That's not the right approach. These
Right.
words were designed
Right.
to do a knee-jerk reflex in the negative, so nobody would get into that. We will
Right.
stay in the regular medicine,
Right.
which is primitive as can be.
Right.
We are
Yeah.
in the Mesozoic era of the dinosaurs in
Oh
medicine.
my. Yeah.
But
I've
be
had
but
some
be
conversations like that myself, like asking them questions, and then they're like, what? Like, because I think we're all starting to do that a lot, but it's been so much where it's just like, okay, whatever you say, nobody asks, nobody questions the doctor about your body or anatomy. But I think we're starting, like you're saying, we're starting to get a little bit smarter
we
about
gotta
that,
go we gotta go baby steps because
Right.
we as doctors are taught one of the worst lessons in the planet is to think that we're God.
Yeah.
And even though very few will admit it, we're taught that, okay, everything you were taught that is important
Right.
was at medical school. Don't look anywhere else.
Right.
That's the message. And that's
Yeah.
insane,
Yeah.
insane.
It is.
But that's the way it is.
Right.
And then if you question somebody that emotionally, like I was, emotionally, I was a mess. This is the healthiest I've been all my life. That doesn't mean that I may not get an illness tomorrow.
Right.
No,
Right.
it can
Right.
happen to anybody. But this is the healthiest I've been all my life. Emotionally, physically, sleeping great,
Yeah.
exercising. I feel phenomenal. And I'm
Yeah.
67 years old.
Yeah.
So I feel good. And the doctors are so emotionally distraught and stressed that you have to be gentle with them.
Mm-hmm.
As a woman, you might understand that better than me because you're a woman, so you have other perspectives that I'll never have. You see?
Mm-hmm.
You're in charge of perpetuating the human race. You
Mm-hmm.
make babies and you make food for those babies. What the
Right.
heck?
Right.
We'll never do that.
We
No
totally grow.
matter no matter how many hormones I get, we'll never do
Yeah,
that.
you can tend to, right.
You
Yeah.
understand?
But
That's
that is what I was going to ask you is, do you, like, you feel like the doctors do? I mean, you obviously do, but are starting to feel like that, like they're trapped. Like if I don't, like you said, when they ask about alternative, like their reaction is no, because they know that if they answer incorrectly, they're going to be quote punished for it in a sense. Like they have to follow this
yes.
protocol. So like,
Yes.
where is that? And how, if there is that, well then what's the difference between that guy, that doctor that's not escaping, and you who have escaped, so to speak, and allowed yourself to do that? Do you know what I mean?
There's
Like,
no
or
difference whatsoever. we're the same person, except that I have more experience doing other things. You
Okay.
see?
Well,
But
yeah,
we're
that's
but we're basically the same person because most doctors they have the desire and the vocation to help their fellow human being.
right.
They do have that, but
Yeah.
because they have the wrong information, that's a pain in the ass.
Right.
Number
Yeah.
two is it is not. This is very important, and I'm glad that we're having this conversation. It is not a logical argument. It is not a logical argument in terms of, okay, I have the information, I have randomized studies that show all the
Right.
things that I've spoken about today. That doesn't change a person's mind. What changes a person's mind is emotions.
Mm, for sure.
If you feel somebody that you feel comfortable with them,
Hmm.
you're going to go to the ends of the earth with
I
that
agree.
person, even if you just met them.
I agree.
Because you trust them, you feel that person is balanced, that person is
Mhm.
in the right point. Most doctors are emotionally a pain in the ass,
Yeah.
and what that means is that their self-esteem is relatively low.
Mhm. That makes sense.
Self-esteem is a direct proportion and reflection of how much emotional development you have achieved in your life. That statement sounds complicated, but I encourage all your listeners
Yeah.
to read it and write it down.
Makes sense.
Because when I'm dealing with a physician, I know I'm dealing with somebody in most of the cases, not all, there's degrees to that emotional development that have not been taught the importance of the emotional development in everything: intellectual reasoning, cognitive function, sleeping, being
Right.
happy, being clear, focused at work, having the best results possible, all those things. So when you're asking them about these things too directly, you know what you're doing? You are you're questioning and challenging their
Yeah.
self-esteem.
Right.
It has
Yeah.
nothing to do
Right.
with the intellectual scientific
Knowledge.
information.
Right.
That's why I use the oils,
Yeah.
because the oils will take care of half of those doctors.
Right. Yeah. Well, and they're used
Although,
to being the authority. They're used to everybody listening to them. And then all of a sudden, they're used to, what do I do, doc? And then the doc says this, and they're like, okay. But when somebody, like you're saying, when somebody questions them, it's like, ew,
well,
like
we
I'm
have
used.
to be sympathetic and
Right.
empathetic with each other. I mean, there's not
Right.
any other way.
Absolutely. Yeah.
However, if I have a doctor that instead of most of them these days, they just shut up. They don't say anything, or they will get into it a little bit, but some of them will attack. That I used to see. We're making progress because 30
Right.
years ago, 100% of them will attack,
Right.
including family members, etc. Not today.
Right.
Today, we've advanced a lot in that
Yeah.
process,
Well,
so
that
they
was
don't attack.
yeah, that's what I wanted to ask you about because I know that that's something that's important to you. So two questions that you can roll around however you choose is one is how are you doing that? Because I know that that's what your heart is to help integrate the doctors to be more doing what you're trying to do and to educate them. So how are you doing that process? And the other one is what is one of the things that's sort of like, and they may be similar, like a pet peeve, like I in the health industry. Like I'm a fitness instructor, and so I have pet peeves in the fitness industry. Like when people say this. So you know what I mean? When people say no pain, no gain, that drives me nuts. It's not true. And so those kind like what is your one of your things where you're like, no, that's not correct. Like that's drives you nuts.
I would stress the fact that perfection is our enemy.
Okay.
My protocol is cheating proof,
Okay.
cheat proof. In other words, I want my patients to cheat when
Okay.
I make recommendations. If
Cool.
they cheat, they'll do better,
Got it. Got it. Makes sense.
always.
Makes
So
sense.
they have to cheat instead of telling them, no, you have to follow this. I used to say
Right.
that. I was a
Yeah.
pain in the ass before. You
Right.
think I'm a nice guy now? No, I
Got
wasn't,
you.
not always. Anyways, I used to tell them, if you don't do my protocol, it's not going to work. You're
Oh,
wasting my
got
time, blah,
ya.
blah, blah. I was a little insane. No, don't think so.
Yeah.
Anyways, and I tell them, don't do 45 minutes of exercise 4 times a week. You're not gonna do it. You're gonna
Right.
drive yourself crazy. Start with 5 minutes tomorrow.
Got ya. I agree.
Then keep doing 5 minutes.
Yep.
Then whenever you're ready, go to 10.
Yep.
Then
Yep.
after a week or two, whenever you're ready, go to
Agree.
15.
I
And
agree.
that always works.
Agree 1,000%. Agree.
If I tell them, no, you have to take this three
Yep.
times a day with
Yep.
meals, all the pills.
Right.
I said, if you want to take a pill at a time, one
Right.
supplement at a time,
Agree.
cheating is great.
Love that. Love that. Love that.
So,
Yeah. Because it has to be their thing. I don't like the word program, right? This is my program for you to be on because then you're programmed. We had enough of programming, right? We want it to be you to feel comfortable. I love
I
that you
call it
do
I
that.
call it my rejuvenation protocol.
Yeah. Love
And
that.
you just asked me, how do I teach
Right.
this? How do I
Right.
show people how to do this? Basically, in order to go through this process, they have to become my patient and I become their patient. We
Got
have
it.
to, they have to practice with me and I have to show them, they have to go through the whole process
That's beautiful.
to understand because we're dealing with very intimate and personal things.
That's beautiful.
So that's the only way that this can be trained.
That's beautiful. That really is
And
beautiful. I mean that I'm saying beautiful because that's actually what it is because there you do have to having that relationship. Now, are you I know your desire is to have more doctors be that. Is there like something like how are you reaching out to other doctors to
well,
do the
there's two
same thing?
ways. I have a website. It's called vmvoils.com, where
Okay.
I have my courses.
Okay.
And the curriculum is detailed there, exactly what I'm teaching is over
Okay.
7 weeks. I just finished one. I'm taking a break for the second one. And I teach them diagnosis, monitoring, testing to be done, how everything is done, materials to give to the patient, materials for them, how to monitor themselves, how to monitor as a physician,
Wow.
uh, pulse electromagnetic fields, nutrition, so nutritional supplements, medication,
That's
microcurrent, pulse
great.
electromagnetic fields, everything.
Wow.
And right now, I'm in the process of at the end of January, we're working on having a text-based AI. So if they have any question, patients or doctors,
Great.
they can get it there.
Wow.
Now,
That's
the ones that want to go to the next level, which is setting up a clinic, I also do that. I help doctors set up their clinics with
wow.
exactly everything I'm doing. And that includes the crown of the jewel of the crown or the crown of the jewel, or what they
Yeah.
call that. The intravenous therapies.
Okay.
That
Cool.
I don't teach in the courses, even though I mention the results, I mention
Right.
how that can assist somebody get better, like chelation therapy for removing deposits of cholesterol in the arteries,
Hmm.
including and be potentially able to reverse varicose veins, leg cramps, leg pains, angina, cardiovascular problems, high blood pressure, diabetes, et cetera, et
Right.
cetera. And the intravenous treatments, vitamin C, glutathione, there's many intravenous
Hmm.
treatments that I do. Then that's leucovorin intravenous for autistic kids,
Yeah.
phosphatidylcholine. That's taught only to the doctors that want to set up their clinics.
Got it. Yeah.
So that's
Yeah.
how I do it. And I also teach people that want to learn about this,
That's amazing.
regular people. Because
Yeah.
the more informed you are, the better off you're going to be with your doctor.
Right. Now, are you finding that the doctors that are coming to you for that, um, in a sense, I want to word this right, in a sense, they actually need to be the patient for a while before they can be the doctor again. Not again,
Absolutely.
but I mean like kind of simultaneously, like they're
Well,
healing
I'm the
their
patient
own.
number one that I have.
But yeah, but I mean like that they're healing their own body as they're learning to be a better doctor
They
in
have
the
to.
same like do you know what I mean? So
Yes,
are you
they have
is
to, yes.
right.
And I may not tell them that that's what I'm doing, but
Right.
that's what I'm doing.
Right.
But
Right.
basically, yes, that is very important. But you know what? I'm my number one patient
Right.
myself. I'm
Yeah.
constantly doing the things I have to do to stay as healthy as I can.
Well,
And I'm
yeah.
progressing in my life because I want to keep getting better.
Right. Well,
So
that's amazing that you do, because then people can read that too. And like you're saying, you have to have that relationship with, if I go to, if I ever go to, there's been many doctors where I'll go and I'll be like, yeah, no, like because I don't feel that with them, or they're not answering the questions correctly. Just like anything, not just doctors, you have to have that relationship that goes, that you can actually communicate back and forth.
Correct. And I have to thank you today because basically what we spoke about today, it's a summary that can help so many patients in so many ways. I realized all we spoke about a lot of things that are can be
Right,
very valuable to a lot of people.
right,
And
yeah.
they don't have to be doctors.
Right, yeah, absolutely, absolutely. So if like you said, there's so many things that we said, but what would, if you had to say one takeaway that you want to make sure that whoever's listening to this, tell them, you want them to walk away with this thing in their head?
It has nothing to do with what we spoke about already. Do an,
Well, good.
do an emotional scan every night when you go to bed, turn off the
Okay,
lights, put your head in the pillow. An
okay,
emotional scan is the following. We know that we're feeling things constantly: hunger, having to go to the bathroom, thirst,
right,
uh, anxiety, depression, happiness, joy, peace,
right,
tiredness, all kinds of things. I recommend at that time doing a scan from head to toe or toe to head and feeling what you're feeling all over your body.
okay,
When I started doing that, I used to feel panic in this area from the top of my head to the lower neck. Panic. I would feel it there, not in my belly. I will feel it there.
okay,
And the more I felt it, the more it went away. So when you feel those feelings, they're very important. I would ask the people that are listening to this, do you think that pain is good or bad? Most are going to say bad. No. Pain always saves your life. Let me repeat that.
mm,
Pain always
mm.
saves you, period. Because if it wasn't for hunger, you wouldn't eat. If it
Right.
wasn't for thirst, you wouldn't
Mm-hmm.
drink water. If you weren't tired, you wouldn't
Love
go to
that.
bed.
Love it.
All of those things are designed to show you exactly. We don't need to go to a psychiatrist or psychologist for that. We
Right.
need to be aware. And the more you do it, the more proficient you become in everything in life because
Wow.
you know if something is going to kill you or not.
Mm-hmm.
And the body is always trying to tell us something.
Yes.
So we just
Yes.
have to be aware of that. And
Yes.
my guided relaxation and doing this exercise at night are invaluable and they're for free. They don't
Wow.
cost anything, but you have to take the time and practice.
Yeah, and if they're go to Spotify and go to that, how do they find it? What do they
They
look up?
go to Victor A. Marcial hyphen Vega.
Okay.
They put
Right.
my name
Okay.
and
I'll have
the,
that all there
the
for them.
relaxation, the guided relaxation is called stillness.
Okay. Okay.
But there's a
So,
bunch of stillness in Spotify, so you're not gonna find it. But
okay.
put Victor A. Marcial Vega, and people will find it.
Okay. And so would it be fair to say that in general, when you have a patient that comes to you, that is the first thing that you always go that way, or does it just
Absolutely,
depend? Okay, so that's
absolutely.
always the first thing, and then from there you kind of break it down to what do they need next, so to speak.
Yeah.
Yeah, that's amazing. That really is. Is there anything else you would like to say?
No, thank you.
Yeah, I mean, I want to make sure that you say everything you need. I would love to talk to you again sometime. We probably could talk forever. I'd be like asking you 50,000 questions, but I really appreciate that. I appreciate you coming on the show, and I want you to have the last word of whatever you want to say.
No,
You
I
know,
just want to thank you because thanks to you, it gives me the opportunity to get all this information out to the public, and that's one of my biggest pleasures in life. I
yes,
enjoy this thoroughly. I love it. I love what I do. I'm laughing at the office when I'm there. I enjoy it.
yeah,
I like it.
that's
And
that
that's what
that's
I want for physicians because most of them are not enjoying it,
right. Yeah. And
unfortunately.
I love that you have the heart for the physicians too, not just the patients, because like you said, you are on both sides. You've been the physician who's like, so
I
you understand.
understand. I
Yeah.
understand.
And I think that's so important. Um, with anything that anybody teaches, you can have all this, and that's important to have that knowledge. But when you've gone through it, and then you can come out the other end and say, I know what you feel like. I mean, you're for real saying, I know what you feel like because you did, in any industry, no matter what it is, it's like if you don't know, if you've never gone through it, if you've never had that situation, you just don't know. So I love that. I think that makes you even more powerful than you already are,
Well,
because
you gave me a great idea because I haven't been doing that.
haven't been doing what?
I
Saying
haven't
that,
been tell, huh?
telling. Oh, tell your story.
No, 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 not tell the story. I can tell
Oh,
it. That doesn't. I haven't told physicians I know how you feel.
oh, yes.
I never done that.
Yeah.
So now
Oh,
I'm going to experiment and I'll report to
good.
you in the next podcast.
Good. And I want an update. I want to know what they said. But I always say that it's kind of silly. Like, in my industry, I always say, like, if you're size 3 and 20 years old and you're trying to tell me how to, like, lose weight, and I'm 62, and you just don't know. It's not your fault, but you don't know. So, like, I appreciate when somebody's already been through, like, and so that's what I love about, like, what you're doing. That's a fabulous thing to tell people. So we will have all your website, everything, all up there for people to find you. And then also Ask Dr. Victor, correct, is another thing.
Ask
Okay.
Dr. Victor.
We'll have all of that information up there. And I want to thank you for giving me your time. I really appreciate it. And I'm just going to ask you to do one thing with me. When I close my show in my classes, I always say, wherever you are, you make it a great day. And then I say, add some, and then we say together, pizzazz. You got it? Can we do it? Ready? Okay, everybody, wherever you are, thank you for joining us in pursuit of pizzazz. And thank you, Dr. Victor, so much. I really appreciate your time. And wherever you are, whatever you're doing, you make it a great day and you add some
Pizzazz.
pizzazz. All right. Thank you, everybody. Bless you. God. See you. Bye bye.
Thank you.
Thank you.